Hi, and welcome back to Dogs Do Speak podcast with myself, Colin Spence, and the wonderful Samantha Wayland. And today we have a really, really wonderful guest. You all know who he is. It's Sir Andrew Hale. And Andrew will be here today to talk to us about safety first. So, without further ado, I'm going to hand you over to Andrew. Andrew's going to just tell you, for those of you who probably don't know who he is, a little bit about himself, how he got into the industry, and then we're going to talk about safety first. Over to you, Andrew.
Well, thank you, Colin. Thank you for inviting me. Hi, Samantha. Good to see you. It's great to share the space with you both. And so I'm a behaviourist over here in the UK. I live down in Devon with my wonderful husband and our doggies. I'm a behavioural consultant with Pet Remedy and Canine Arthritis Management and the British Isles Grooming Association. And I've got a human psychology background. So uh, I was involved in human therapy for probably about getting on for 15 years. Before my own breakdown, I talk about this when it's appropriate, but that's what changed things for me. I had my own breakdown, and I think it just shows that you can be. In fact, I look at why I went into psychology in the first place. It wasn't just an interest in the topic, it was because of my own subconscious attempts to find answers for myself, I think, because of my own trauma as a child, and that kind of caught up with me when I had that period in my life, and that's how I ended up coming into working with animals, really, because my amazing therapist that I ended up having that helped me guide through that, and I was out of action for a good few years, actually. It was quite a deep time in my life of working out a lot of stuff, but his brother was involved in animal husbandry in zoos, and I just found it very interesting. And on the progressive side, doing positive reinforcement, and that got me really interested in it. And it was my late mother actually who said, why don't you work with animals? And I thought, well, I like dogs, so maybe that's the way to go. And so luckily I found the kind of great educators, you and I, Colin, both through the ICP, and going to the IMDT trainings that we used to do back in the day, which was, I look back at those times, guys, I think something has changed in our community, in our industry a little bit.
Yeah.
Maybe it's kind of pre-COVID, pre the kind of a big advancement of social media, I don't know, but we met each other in real life. We met each other at conferences and IMDT training, or other training providers are available. And we had these kind of communities, and we kind of we got accreditations because we believed in that level of accountability. And then our colleagues in those organizations, obviously we're Association of Interdogs, and and there was a level of understanding about our professional integrity because we signed up to a code of ethics.
Yes.
And I'm just so glad that I came into the community. I'm talking, well, actually, this year is my 15th year of being in practice, actually. And I think I've known you, Colin, for about ten of those. I think we go back with the old grand arms of the community. But yeah, so I think, yeah, anyway, so that's my story anyway. That's where I kind of came into things. And I've always been interested in that kind of individual lived emotional experience. I guess that's what kind of connects it all together, whether it's the back in my human days or working with dogs. I started to question a few things just in my own mind, and then it was the wonderful Sarah Fisher who gave me permission to think more freely, and then meeting up with people like Laura Donson, Kim Brophy, and Tua Drugas and others, and just thought, yeah, we can question. We can ask different questions without necessarily always having the answers. And I think that's what I've tried to do with my dog centre care platform, really.
Okay. Andrew, you know, when I first knew who you were, you and Sarah Fisher actually changed how I think and work. So I owe a lot to you two, to be quite honest. Both of you have just changed the way I do things over the years. But coming back to safety first, yeah, what does that look like? What is it?
I think it's a very simple, but a lot too, of course, but understanding that when we think about the individual lived experience, is everything is about safety ultimately. And there's a great quote by Dr. Peter Levine, who's a trauma expert. human trauma expert, that says finding safety is the treatment, creating safety is the work. And I think that's a good way to live by as a professional, because safety always is the way. Because if you've got a dog, for example, who's feeling safe and well regulated and motivated, they're going to learn better. Same with us at school. Many of us didn't function very well at school because we didn't feel safe. And so safety first for me, this is what I educate a lot about. For us as professionals, especially, is I love this notion of creating safety as the work. And I work with kind of activity and aggression, like many colleagues. And over the years, I've ended up working with the end that the dogs, especially, I love working with the ones that might be labelled as potentially dangerous, but they're dangerous because they don't feel safe and they're not feeling heard, and they're not finding relief for what it is they're trying to communicate. And relief is a big aspect of safety. And so yeah, so safety first is about that, and understanding the three primary domains of safety, really, for me. Physical safety, of course, and actually we have a bias when thinking about safety in another, whether it's the dog or human. We tend to have a bias towards physical safety because that's what we can get feedback from. But our own brain and the dogs, and anybody who heard me talk at ABK last year, I was talking about social safety, but our own brain is just as if not more focused on emotional and social safety. We can unpack those two in the moment. And that's why you can be safe physically, but not feel it. And so we have to think about then the big thing for me, the big shift that's happening in relation to dogs specifically, and this is why we talk a lot about stuff. This is why I was involved in that kind of beyond the operant conversations and stuff. And the important word there is beyond. I'm not a fan of this, what I'm going to just touch on now. I really want to make it clear that I'm not anti-training, and I'm definitely not anti-trainer. Some people have gone to that extreme, and I think it's very unhelpful. And one thing I would say to dog trainers listening is, especially if you're starting to think a little bit differently, um, I'm more than happy for somebody to call me a dog trainer because I get to decide what a dog trainer is. They can have as many assumptions as they like, but if they want to call me a dog trainer, that's fine. I'm happy to be a dog trainer, but I know, you know, we can decide what that is. And guess what? The general public do know it, and they're already bombarded with loads of other things already. So I wanted to throw that in. When we think about the movement to positive reinforcement, that was definitely us moving on from predominantly aversive compulsion-based training, showing that we could get behaviors, change behaviors in a more humane, nicer way. These conversations, it's about moving forwards, about recognizing that actually just because we can change the behavior of another, even in a nice way, and we have to understand the coercive potential of reinforcement in doing that, it isn't helpful if the animal or the human still doesn't feel safe, still doesn't feel heard. And most importantly for me, because I think the word relief is probably the most important word in the psychology of behavior anyway, if that animal is trying to find relief for physical pain, emotional pain, social pain, and in fact, most challenging behaviors are relief seeking. If we're not offering that relief or that safety, then we have just changed the behavior of another. And I think that's what we have to be better at. So safety first protocol is recognizing that the dog has their emotional, physical, and social safety needs. So do we as a professional, and that's the one that we overlook most of the time. And so does the caregiver. So does the caregiver. And so it's no point moving forwards with the dog, but actually putting the caregiver in situations that they're struggling with. If you have a caregiver who hasn't done the homework or hasn't done this or hasn't done that, it's easy just to judge them as thinking, well, you're not committed. Often it's because they feel uncomfortable doing it. I worked with a lady a little while ago who was being asked by the previous trainer, great trainer, but hadn't taken into account her emotional and social safety needs. And she was finding herself being pushed into situations that she found socially unsafe. So it's no wonder she didn't do them then. So the range of safety is where we should be looking at, and we call it the range of safety in psychology, and that's just where the dog, the caregiver, and I, as the professional, where we all can feel as safe as we can. That's where we should be working.
Yeah, I think that's massive because I think we tend to focus on the dogs have their individual needs. The dog, we need to work with the dog in front of us. We need to do everything, but we don't always think about the person in front of us. You know, we're like, well, I'm going to give you a training plan and I'm going to type it all up and I'm going to give you this and I'm going to give you that. And that's great for, you know, Tom, Dick over here, but Harry over here might really, really struggle with that side of things. And I think we need to focus not only on that, but on that as much as we do as the individual dog, but the individual client as well.
Yeah, for sure. This is that shift from task to care, I think, which is something else that I talk about, because dog training has been historically very task oriented. That just means quite transactional. So the task being, you know, teach the dog a new thing or get the dog not to do something or whatever it is. And uh, the problem there is, and I think a lot of trainers and positive trainers can get stuck in the task at all costs thing. um, if the task can't be completed, then it's quite uncomfortable because the social brain has to blame, right? Because the task hasn't been completed. So guess what? The dog isn't good enough, or the caregiver isn't doing it all right. And ironically, the dog trainer who is prescribing a very heavy task approach, but guess what? The dog can't complete the task because of other reasons. They feel they're not good enough.
Mm.
So it's actually really counterproductive. A care approach is not about not doing task. I do. We were talking about Sarah. Sarah Fisher, Sarah and I are both involved in helping quite a big assistance dog charity here in the UK that has their own breeding program to completely look at changing what they do in that first 18 months for those dogs before they do their training. So those dogs have a really important task to do because they could save somebody's life. But we know that the task is more likely to be done if the animal is physically and emotionally well regulated. So the care approach for me is just learning from the other first, taking care to learn from the other first. So, for example, you know, if I was your boss, Samantha, and you came into work and you were like, well, you know, my dog's not very well, or you know, something's happened in your personal life. A task-orientated approach would be on, I'm terribly sorry, Samantha, but you've got a job to do. Because task is supreme. Whereas a care approach would be, look, you know, come sit in the office a bit, see how you get on. If you need the rest of today to take off, you know, that's just a care approach. I'm still thinking I need you to be productive at some point in my employee. So I think this is the shift, and this is where I said earlier about not being anti-training, because I'm totally not. But I've got my little kind of care mantra really, which is learn, support, teach. And I think if we just stick to that, we can't go far wrong. And this is the same for working with humans and also looking at the person in the mirror, actually. So learn about the experience first, learn from the other first, learn from the dog first, support what we learn. And then teach things, if we're going to teach anything, that are likely to be intrinsically valuable for that animal to be able to cope better and feel safe and feel heard and find relief. After that, you can train what you like and totally train what you like. I think, but it's the same for our clients. I need to learn from them first. You know, when I first go around to see a client for the first time, we can talk about this in a minute, actually, about our own safety, about having a healthy professional presence. So I'm quite confident in what I do. In as far as I know why I'm there, and I know how things are going to work. I don't feel I have to express to them that you know, chosen well in my employ. I'm quite confident in that. So actually, the only two things I really want to do when I go and see a client is, first of all, I like to sit, if I go to their home, where I want to sit, because I need to feel comfortable and safe, especially with some of the dogs I'm with. And secondly, I want a cup of tea. I want a cup of tea, and because the point of the cup of tea for me is, and if they don't give me one, I will normally say, oh, I'm a bit thirsty, can I have a glass of water? And then, oh God, would like a cup of tea? I'll have a cup of tea. Preferably with some biscuits as well. But and then I just want to shut up for half an hour. I want to hear from them. I want to learn from them about what their experience is without challenging them. I want to hear their experience, because in my experience, the clients actually, what they really want from me is two things: is one, to feel heard, and two, to have a plan. They're not necessarily, you know, we can make assumptions about them thinking, well, you know, they want me to fix their dog or whatever else. So they might not. I don't know. I don't try not to get into the realms of second guessing other people's assumptions. But so yeah, that's a care approach. You see, that's the care approach. Just learning from others first, and especially with these dogs, they've got a story to tell us. I call it the survival story. These animals who end up using the ultimate sanction they have, which is their teeth, they have a survival story, and I need to learn it. I need to learn it to bear witness to that, rather than just arbitrarily change their behavior. And I think for us as animal care professionals, animal behavioral professionals, we need to understand the importance of behavior, because I think there are many people who think they know about behavior, but in fact they just know how to make an animal behave. And there's a big difference. And I see behavior like painting a picture. I want the animal to paint the picture for me as much as possible. I don't want to keep grabbing the brush all the time thinking I can paint it better. And that's what we can do if we fall into training first. If you behave like this, rather than thinking, and obviously if the dog is going to use their teeth, I have to mitigate for that because I don't want to get bitten, but I want them to behave. And I think we have to empower caregivers to understand the importance of behavior. And rather than see measures of progress based on behavior on or off, because that can drive you nuts. If you've got a dog who barks at other dogs, they like to have a woof sometimes. Instead, just recognize the difference in that intensity, the frequency, how quickly the dog recovers. All these things are telling you more information about how well they're coping rather than whether they've behaved or not. And especially if you have a trauma-informed approach, we can touch on this a little bit in a bit, but you know, a lot of dogs, they need to feel comfortable. They get safety from being able to communicate. And no dog is safer to be around by being made to feel less safe, as I say. And definitely no dog is safe to be around by being made not to feel they can behave. Because if that dog needs to have a woof or a grumble, I want them to. Because I need to know, okay, that's not working for you. Let me see how I can support you, rather than thinking, oh no, the dog's barking. So, but this can get easily misconstrued as letting them get on with it, or over threshold. And I think we've got to change the language on some of these things, so that we can truly help. And especially when you hear like people like Kathy Connor, as she's now, and others, Daniel Shaw and others, who talk about the neurology and stuff, about the importance of allowing stress cycles to happen. But that's perhaps a bigger topic for another day. But yeah, waffling on.
No, I like the way you've put that. Learn, support, then teach. Because I tend to see, just like yourself and Samantha, task is always put first. And there is no conversation. So we're not learning what the other person would like or what's going on for their dog. And we go straight in with tasks. Dogs cannot learn if they're not in the right physical capacity, or have the right physical capacity, or in the right mental place. So I do love that. Learn, support, teach. Absolutely brilliant. How do we go about the learning part? I tend to find most people, or people new to the industry, are least likely to do, because they feel under pressure to just go straight in. Yeah. How do we get them to will that back so that we can start learning, listening, supporting, and educating?
That's a really, really good point, what you said there, Colin, because to do really good observations and allowing the animal to behave, we have to actually address some of our own insecurities first. Because if you're brought in to help with a case and the animal behaves, especially if they end up behaving in a way that others might perceive as being badly or whatever, you can feel a pressure on yourself if you're insecure to think, well, hang on, that's reflecting on me as a professional. When I first meet the caregiver, my assessment process is always over 3 sessions to start off with, and sometimes I go to their home, sometimes I don't. Sometimes I do the first one over Zoom, sometimes I don't. Whatever. I'm lucky to have a big 2-acre space that I do a lot of observations in, and I don't feel under any pressure. I just want to see what we see, and that definitely doesn't mean putting. If the dog struggles with dogs, I don't want to see the dog around dogs then particularly. If we go out on a walk, I'm not pushing the dog to do stuff that's going to make them stressed. But I do want to just see what we see and the small stuff is the important things. And I think to really be able to see the small things, you have to deal with your own insecurities about the expectations you put on yourself about how you're supposed to be performative. I remember speaking to a colleague a little while ago who felt the need to kind of show some funky, cool training-y stuff to let the caregiver know that, whatever. When we unpacked that was more about their insecurity than actually what the caregiver needs. So I think we do have to, that's a good point, Colin. I think we do have to have some confidence, think it's okay just to see stuff. We never want to see a dog in distress. We never want to see a dog that's kind of really kind of not coping, and we'll address that. But I think we do need to think, okay, you've employed me to see your dog about dogs, fine. But actually, in this first session, I just want us to see how the dog is with me. I want to see how, and quite often you'll get people say, yeah, but the dog hasn't got a problem with people. But actually, most of the time they kind of do, because they're not processing very well. For me, the three important words I think we should all be considering when we're looking at observations, especially regarding social and emotional safety, is processing, engagements, and exits. Now, these three words are used from the human psychology therapy side of things, because a big question we've got to ask is about safety, especially if physical safety isn't the only one, emotional and social are. How do you learn that then? How do we know how another is feeling? And so in human, especially in the those people who work with non-verbal or pre-verbal children, they look at processing, engagements, and exits. I think they're really good for us. So processing is just looking at how the other process, because we all have to process. So sensory integration is how we process information through our sensory system and how well that gets integrated. And ideally, it should be integrated predominantly subconsciously. Otherwise, it'd be very overwhelming if you're aware of everything. And of course, the more anxious you are, the more those sensory dials are dialed up, of course. So we can learn a lot by just saying, hey, how does the dog process the caregivers? How does the dog process me? How does the dog process the environment? Why is the dog not processing very well? What is causing that? Why is that nervous system maybe getting in the way of them processing well? If we think about the brain has lots of little doors in it, we want to keep as many doors open as possible for the brain to be able to process well and have good sensory integration. But pain, and that's physical pain, emotional pain, social pain, trauma, and stress of any kind, and that includes excitement and frustration, they're all big door closers. And what we have to recognize, guess what, for us humans, the first doors that are likely to start closing when we're getting in that more elevated state are our more rational doors. And the doors that are left open are our more survival, reactive, responsive doors. In dogs, the first door, this is why learn, support, teach is important, because the teaching of things that we feel from our observations are likely to be more intrinsically valuable, just as in valuable to, because when the dog's doors start closing, the first doors that will start closing will be the doors we put training behind. Because most of the training we do, especially the traditional stuff, has no intrinsic value to the dog whatsoever. And the doors that stay open are the survival doors. And this is why the public need to understand this, because guess what? When they ask Rover to do something and they don't, the traditional approach is, well, that dog must be stubborn, willful, disobedient. But in fact, the dog just doesn't have those doors open right now. When they've calmed down a bit and the doors start opening, they'll do it for you, but they can't right now. So processing is important. There's a lot of things to understand about processing, especially when we think about social safety in regards to what's called social information processing theory. Really important. Social information processing theory alongside attachment theory. Those two things go together very well. And you can add in kind of polyvagal as well if you want to, but those things are very important. So social information processing theory kind of looked at initially very young children who had behavioral challenges, socially behavioral challenges, and it looks at how the brain encodes information from the social environment. What does it pick up from it? And this is very important from a processing point of view, because we might think the dog is being overreactive. We might think the dog is responding to something that isn't a threat. But what is that dog's brain encoded regarding the social environment? So a good example of this with children is if you've got some kids playing in the playground and a kid bumps into another kid, the kid that's been bumped into, based on that encoding, does he think, oh, that was just you just bumped into me having fun? Or has that brain learned that was a threat? You did that on purpose and I will punch you. And now we had to have a child who is being judged as being aggressive or behaviorally challenged, but in fact, that's just how they've encoded. And what we must recognize now when we start understanding this, especially with processing, we'll come on to engagements and exits because these are also part of this, is we have to completely rethink what we do and what we talk about in regard to socializing. Because there's a friction between the more traditional notion of socializing when we think about it in human terms as well. socializing, as getting the animal or the child to be able to respond appropriately within the social environment and be able to cope. But that is at friction with the individual's ability to feel safe to do so. And actually, socializing doesn't start on the walk. It starts the moment that dog sets foot in your house, because it will be encoding that social environment, especially as a puppy, of course, but even as an older dog. How does this social environment work? If I express something to you, do I feel heard or not? Because that's the point of emotional safety. Emotional safety is very much kind of entrenched in feeling safe to communicate how you feel. Then social safety is about understanding the support you get from your social network in response to that communication. And that comes into the realms then of attachments, and secure and insecure attachments, because we always seek attachments. And if they're not secure, then they become insecure. And that's something to bear in mind when we're working with the general public, because if somebody has developed because of their own childhood and the attachments and that social information processing stuff, and they've developed an anxious attached style, then they're going to have that with their animal. Equally, if you as a dog trainer listening to this now, if this is why I really think we need to look at our own emotional health journey a little bit, and how that relates to our professional presence. And I'm a great believer in working to find our healthy professional presence and understanding, actually, do you know what? I do have an anxious attached style, and I have created an anxious attached style to my business. And I've created an anxious attached style to my clients, or an avoidant attached style. So when I work with a client who's seen somebody else, and when things aren't going very well and they're contacting the person and they're not getting a response all of a sudden, that kind of implies, maybe, I don't know, that the professional has an avoidant attached style, because that's the whole point of being avoidant. So I can't deal with this. And actually, a lot of studies have shown that caregivers, owners who have avoidant attached styles and even disorganized attached styles, which is a bit of a combination. But the studies have been mainly on avoidant attached styles are more likely to pose a welfare challenge for their animal, for their companion animal, because they would also for their child. Because it's better to avoid stuff, not deal with it, than deal with stuff. So processing, big topic, right? We could do a whole podcast on it, but it's important to learn it, because we can just think, okay, how's the dog processing the world, or why isn't the dog processing? Why is that dog not using its nose to socially process? Because that, we know that's the first sign of socially processing, essentially why they like interact. Then engagement is another one that we look. How does the dog engage with the world? What does that engagement look like? We all want to feel we have choice and agency over engagement. And then also finally, exit. If the dog does engage, where's the exit? What do exits look like for this dog? And if the dog doesn't want to engage, what do those exits look like? And trauma actually is very founded in a lack of agency over engagement and exit. When you think about it, you find yourself in something you didn't want to be in and you can't exit. When we think about the young developing brain, then this is really important, and this is what Sarah and I are doing with this charity, and this is what I do with some of my education. I've got videos showing all this stuff, because it can be, because when you see it, you can't not see it. That young brain, especially the young dog, needs to process a lot of stuff.
Yeah.
You know, my little rule of thumb is, if I've got stuff in my freezer that's older than the dog, I've got to give that dog more time. But when do we give more time? Especially the general public, you know, bringing up a dog in a more naturalistic way is actually a lot easier in some ways, because we're just thinking, okay, I need to give you time here. I've got a great video of a little Molly at 16 weeks teaching me, remember, learning. I learned from her. How do you need to process the world? How do you need to engage with the world? And I will make sure you have your exits. So processing engagements and exits are really important. So a lot of these young dogs, then, they don't have enough time to process well. Engagement comes first often. The environment just comes to them. Dogs run up to you, people try and touch you, whatever. And guess what? They don't have exits. They don't have the nervous system doesn't believe an exit is possible. And one thing I would say to dog trainers is, we talk about learnt behavior a lot. We have to be cautious that we're not just thinking about learned behavior purely in a cognitive sense, because the nervous system is learning too. In fact, we know from human studies, our nervous system is fully aware and ready prenatal. So this is why, even for humans who, you know, might be, this is why CBT doesn't always work very well for some people, because you can think as many different ways as you can, but if your nervous system doesn't believe it, if your nervous system doesn't feel safe, it's really challenging. And that's why, coming back to safety first, when we're working with these dogs, We have to work in a way that we have these observations, processing, engagement, exits, start to let that nervous system know it doesn't have to engage actually, and it can find exits, and you can have more time to process without focusing on just because the dog behaves or not, just recognizing that's just a manifestation of some of this stuff, so that they can actually come to believe it. And this is a truly trauma-informed approach. We talked off air about the golden rule of a trauma-informed approach is try not to add more trauma. And if we're not allowing ourselves to have good observations and not feeling pressured to dive in to do stuff, we risk just projecting our own version of safety onto another living creature. Because if they behave like that, then they must be okay. In fact, they're just probably learning, I need to behave like this to get stuff. And I'm just going to share this with you. Some of you might have heard me talk about this before, but I think this is why I'm so really passionate about this, because my own story, because I had sexualized abuse as a child, non-family members, and it changed my behavior. This is the point. My behavior changed. It was a very crucial time in my development as a child, and I pushed back against the world. And one thing about trauma, really important to recognize, we talk about environmental stimuluses a lot in dog training. It doesn't necessarily mean anything, actually, in as far as nothing changed in my environment after my trauma other than my perception of it.
Yeah.
So my school took quite a hard line with me, and I ended up getting the cane eventually. And guess what? It worked. Punishment works. If we think about purely having a metric of behavior less. So I towed the line. My parents, this is the thing, before my abuse, I had everything. I was an absolute spoilt little brat, and I got everything I wanted, and life was fab. The thing, though, that changed after that was I realized, oh, my parents are never around. Because the reason I got everything was because my parents worked very hard, and they were both professionals in their own right, and they did a lot of stuff, and I had like nannies or family members that would look after me. I never thought about it before that, because my brain changed. Remember, safety, social safety, especially my return to safety. I thought, well, you're not here. So I blamed them, and I was horrible to them. So my father took that as thinking, that's just a change in you, because he didn't know about my abuse, because I never told him. So they had an approach of, look, we will spend more time with you. We will spend more time with family. I won't work away as much as long as you behave. Contingent, because we like contingencies. So guess what? I did behave, because I wanted to be with them. I wanted more love. I wanted more time with them. I had plenty of love, but I wanted that. So my behavior changed. That's the point. But the consequence, though, of just changing behavior without finding safety, without finding relief, was my drug addiction and breakdown some 15 years later. This is the point. So a truly trauma-informed approach, we cannot go in and think about behavior change. We have to think, I need to bear witness to your survival story so that I can tread carefully to support your way through, so your nervous system finds that. Because we talked about the doors analogy earlier. Those doors that get shut by trauma, they shut very firmly, and you can't force them open. So behavior is no real measure. This is the big shift, of course, in behavioral science, because back in the day, the science side of things, oh, we don't know about emotions, we can't really measure it. The wonderful Candace Pert in her book Molecules of Emotion recognizes that if science can't measure it, it's a non-thing. But the problem for the individual is those non-things are often everything. And to even put the word emotion in an animal science paper 15, 20 years ago meant it wouldn't be peer reviewed. But that's changing now. We are understanding we can be better at turning up to the other, and we can allow a study of one. I don't have to look at a dog and think, well, what was the paper on that? Or, where's the book on it? I think, well, you know what? It's a bit odd, but I keep seeing it. I keep seeing it. And maybe this is a thing for this dog. And this is where the wonderful Sarah Fisher has gifted us a lot of this stuff through free work and other things, and the ability to observe without judgment or label. I think it's an important thing. So processing engagements exits tells us a lot, and trying to think about how we support those by teaching the dog intrinsically, yes, an exit is available. Actually, you don't have to engage with that. I'm not going to keep forcing you to have to do that because I've decided that it's appropriate. I look at a lot of the dogs I work with. There are things that we think, yeah, we can shift the dial slightly here, but there are some things that this dog is clearly saying that just isn't going to be capable for me right now, and we revisit it. And it's being humble enough for that. It's called sensory mapping, which is again another term I brought over from the human psychology world. But that's kind of what we do if we're doing it well. It's like, okay, here's a layer for you as a dog, especially if trauma side of things, and we will wait for that feedback from you. The problem with cues and training is, where's the feedback? It's like, oh, hang on, so you're not doing that, so I need to change the reinforcement schedule. I've got to, ramp up the reinforcer, without thinking that's not happening. And they're subtle layers because we want to see that, not the dog cognitively necessarily, but the nervous system to let us know that that's okay. That's okay. Okay, great. What about this layer? And thinking about the different types of layers that we put in, the kind of environmental layers, the social layers, the auditory layers, the olfactory layers. For some of these dogs, they need it like that, just a little bit. I think a big problem for some professionals is feeling, well, that sounds amazing, but how do I sell that to a client? Well, if we start thinking in those terms, we never will never do it. If we have that healthy professional presence where we think this is what's going to happen, we have the 3 A's in psychology, and I think that's what we have to think about, which is awareness, acknowledgement, acceptance. So my role really when I turn up is to help the caregiver become aware of the dog's real care needs, care and support needs. I also need to be aware of theirs. That's the point. Then I need to support them to acknowledge what it is, because, and that's the big tricky one for many caregivers. This is why I think as professionals, we can't be held responsible for final outcomes because there's too much variables with these tricky cases. So often the acknowledgement is hard. So now they're aware, for example, that their dog isn't being dominant, naughty, difficult, whatever. Actually, the dog is in pain or the dog is emotionally stressed, overloaded. Now that they're aware of that, because we've helped them through the observations, they need to acknowledge that. And that can be hard because one of the big problems now is guilt, of course, because they're like, oh my God, now I see it and I feel really bad about using the shock collar or using this or using that. Also, some people can't acknowledge it because of their own heavy conditioning.
Yeah.
If they've been somebody I've had so many people who are like, well, I get that, but surely there must be a consequence. I had a lady who said to me once, I get it, but it's like I say to my children, you can feel what you like, but just don't show it. So that I can't be responsible for that. I can help them to try and navigate that. But ultimately, we really need them to get through to acceptance. And the beautiful thing about acceptance, and this has been shown with studies with mothers of human children who have different ways of seeing the world and kind of connecting to the world. And before they knew that, they just saw their child being naughty and having tantrums, and they had the judgments of everybody. By being aware that their child's perceived the world differently, had different kind of support needs, and then being helped to acknowledge that, when they move to acceptance, it unlocks the advocacy part of the brain. Because now they're like, right, same with my clients, when they get to that point of acceptance and recognizing, right, this is where my dog is now. I don't give a toss what anybody else thinks. I will do what I need to advocate for my dog right now. That's the power of it. But some people do struggle with acknowledgement. The guilt bit is the easy one in some ways. I think we just have to invite people to. It's important not to say to people, don't feel guilty, because I don't think we should tell anybody not to feel anything. It's more important to recognize the two directions of guilt. If we stick with it, then the direction of travel is to the past. And that's tricky because we can't go back with it. If we say to somebody, that feeling you have now, it just is telling you that you have learned something deeply and viscerally as a lesson, and allow that to drive your actions moving forwards, our direction of travel is now forwards. And even just talking to our clients in that way, they can think, right, yeah, it's meant to feel uncomfortable because I've learned today, actually, my dog was struggling. And yesterday I thought they were being naughty. I've learned something different. And that means that they will never use that again. I've talked about this before as an example, but I worked with a guy, a stereotyped kind of blokey bloke as you could possibly think, a divorcee, ex-military, all this kind of thing, really manly guy. And when his dog used to bark at other dogs, he used to hit the dog with the end of his lead. He had a 3 meter or like a 6 foot or 8 foot, whatever, leather lead, and he'd whack him on the bum. And this is why I think for us, core counseling skills are things we need to be educated in, advanced communication skills, if you like, because I'm not there to judge him. You know, I'm not there to whatever. I just need to hear him and understand things and go through a process. So it's the same if I meet a client who has a prong collar or a choke chain or a shock collar, which is getting more prevalent sadly. But all I want to say to them is, I get it. I want to hear why you're using it, and I use that word, that phrase, I get it, and I hear you, because I want them to know that even if I don't get it, I'm still going to say it because I think, whilst I'm working with your animal, I'd like us to try this. I had a lady who had a prong collar, and it took about 7 or 8 months before she sent me a photo with the prong collar in the bin. And it had taken that long because the reality is, if I said to somebody, I'm not going to work with you if you use a prong collar, they probably won't use it while I'm around, but they will when I'm not. They have to go through their own journey. And we went through a journey of introducing a harness and a head collar. I know people don't like head collars, but this dog was the size of a bloody cow. And we had a dogmatic head collar, double-ended lead harness, which was preferable to a prong, right? And then eventually she got used to the fact she didn't need the head collar, just the harness. And then sometimes she still used the prong in different situations. And then eventually her confidence got to the point that she could take the stabilizers off, because that's what it is, because she could learn to ride the bike without them. That is how we should be working. And with this guy that I was talking about, he was able to say to me, because of his revelation, going through awareness, acknowledgement, acceptance, that included his own behavior. Because he was able to say, do you know what, I understand why I was hitting my dog now. It's because I was angry and I was embarrassed. The chances of him hitting his dog again now are really small, because he can not only advocate for his dog, he can advocate for himself too.
I think what's really fascinating with that, what you said, is, again, we're looking at the difference between whenever we're talking about dogs and we're changing behaviors, we're like, okay, they've got this neural pathway. What we're going to do is try and get them to figure another way. But again, with the people, like you're saying, with the prongs, she's used that prong for, say, 10, 15 years on however many dogs. That's her way of thinking this issue. I'm going to use this. We're trying to sort of show them another way, but we can't just expect that change overnight. It's sort of introducing it slowly, and like you said, getting them to advocate for their dogs once they sort of understand and accept the issues. Do you think that maybe there should be some part of, obviously there's many providers that we said earlier for behavior and training for dogs, should there be parts of that almost teach us, not the counselling side, but maybe more of the psychology side? Because we do focus a lot on the physical pain, which is hugely important, of course, but we don't really talk about the psychological side very much. Do you think that should be something that should be focused on more?
100%. I think sadly, this is just my opinion. Gotta be careful. I always try to be careful how I put things across, but I just think a lot of things need reconsideration, including the education that's put out. Most of us, myself including, when I think about my structured education, had a heavy learning theory bias. Looked at the science of that, because there's a lot of science there behind learning theory, and especially operant and conditioning generally. We can end up being trapped in that. And if we want to truly be led by where things are going, a lot of this is freeing us from that. It's freeing us. When you start understanding more about trauma and physical pain, emotional pain, when you start thinking about attachments, when you start understanding, some of the kind of nervous system stuff, especially the way that it kind of speaks to itself backwards and forwards, and how it stores pain information, physical pain, and also, different things. It makes you realize we've got to change stuff. And that also, we have to recognize that the general public, we've got this odd situation where we've never known more about the individual lived experience of a dog. Got a long way to go, but we've never known more. But the general public have never been more detached from that. And I think part of the problem there is many professionals in the dog training world are inhabiting the same space, just arguing about how to do task. I call it the opera merry-go-round. And then the general public are thinking, well, what's all this about? Because guess what? There is 101 ways. And most of the arguments that the aversive people put out there, they support that narrative. We have to change this. There's a big pressure, but we have to upskill our professionals in this stuff. And core counselling skills is important. The psychology is important. Think about physical safety as well. Physical pain it is heavily associated to emotional and social pain. A big study was done on men in the 80s with HIV. This was done by Dr. Cole. And he was fascinated to find that when they scored their pain, gay men who were out and living in a gay community scored less consistently than those men who were living a secret life. We know that separation from others, so this is social pain, it changes us physiologically. And so people who, so going on from that research, people who have good, supportive networks, loving relationships, they cope with pain differently than people who don't. And it even changes us physiologically. So Dr. Cole again, and also somebody called Dr. Cassiopo, who's not with us anymore, but he's written a great book called Loneliness, looking at the science of social detachment, if you like. And by the way, loneliness is not about being alone, right? If you don't feel you fit in, this is a big thing. We've got Pride Month right now, right? You can be amongst 1,000 people, but if you don't feel you can fit in, your brain perceives that as some form of social detachment. It dials down our antiviral response and it dials up our inflammatory response just by feeling that when we have it over a chronic period of time. This is why their research is so fascinating, because it makes sense. Lonely people, chronic loneliness, you're 25% more likely to have coronary heart disease, which makes sense if your inflammatory system is dialing up. And this might seem odd, but it isn't when you think about it, because as a social species, if my brain, if my nervous system is thinking I'm not being social, why have any antiviral responses to social disease? And if it's thinking I'm on my own, nobody's going to come and help me if I get attacked, I better dial up my anti-inflammatory response. So it's all very connected. Safety first, of course. And so we have to understand that with caregivers. If you have somebody who's there's something called social evaluative threat, and this is the work of Naomi Eisenberger and Matthew Lieberman at UCLA. Another great book called Social, if you're interested in this stuff, really, really good book, loads of science on it. Social evaluative threat. There's a little part of our brain. And by the way, all these people who do these things, even when we think about John Bowlby, who came up with attachment theory, he didn't get his inspiration from children. He got his inspiration from Conrad Lawrence, who we know in dog training, of course, and Harry Harlow, who worked with monkeys. He got his inspiration from how animals process the world. Social information processing theory came from looking at social mammals before they started thinking about children. This thing about the Dr. Cassiopo and Dr. Cole's work on dialing up inflammatory and dialing down antiviral, they say very clearly this is likely to be the case for all social mammals. So, it makes sense. We're not different in that way. So social evaluative threat then is a part of the brain, which the dogs have too, which is always seeking the possibility of social rejection. That's why with our clients then, when they're out and their dogs are barking and lunging in public, that part of the brain is firing right up. If they were in the middle of a 20-acre place on their own, they wouldn't be caring about it. But they do now because of their perceived judgment of others. If we don't help them navigate that, then we're failing that end of the lead. We have to understand that. At least we don't have to become psychotherapists, but we have to understand it enough to think, right, I get that, and this is why that's happening, and help them through awareness, acknowledgement, advocacy, because advocacy will help that a little bit. But also with somebody who's very attuned to social rejection, it's very hard to have healthy boundaries as a professional, because we talked off air, most of them, all of it. The problem I've had with some people in the industry has always been on the back of me applying a boundary, saying actually I'm not going to do that, or this feels uncomfortable for me, or whatever, and even saying to somebody, can I give you some advice? It's likely to fire up their SET, their social evaluative threat brain, and they're already getting quite affronted. Because, if you've got somebody with their dog barking as a dog trainer and you walk up to them and they don't know you, say, oh, hi, I see you struggling there. Can I give you some advice? They're going to be like, F off, right? And that's probably me telling them to F off, actually, because we've all been in that situation. This is important.
And as a mum as well, I've been where you've had the screaming toddler. It's the same. And someone goes, oh, what you could do. And you're like, well, don't talk to me now. It's all the time.
Yeah. So it truly is safety first. I think this is the key. It's about understanding this. I think I haven't done anything for a while content-wise, but I'm putting out a safety first course actually, just for professionals who understand the three dimensions, a lot of the stuff we've talked about today, but and then think about, okay, what does this mean then for the dog? What does it mean for the caregiver? And what does it mean for us as a professional? And think about emotional safety for us. There's going to be an emotional health element to that. Increasingly over the last couple of years, I've done more education actually on our side of the lead, because it's lacking. There's some great content out there about burnout and imposter syndrome, that kind of thing, but it's quite stiff and a little bit detached. We need just realistic things for you as Samantha, you as Colin. What does it mean for you and your individual story? Because we're all unique in that sense, and understanding it. And it's not about fixing stuff. It's about changing our relationship with stuff. We can't not judge because our brain is designed to judge, but we can change our relationship with that judgment and make sure it doesn't drive our responses in relation to clients and other people. We can understand, actually, do you know what? When we think about attachment styles, especially, they're not rocks to put around our neck. If we understand, you know what, based on that, what happened when I was younger, or my own parenting styles and my parents, I am probably a bit, I have developed some anxious attached styles. It's just being aware of that. It's been thinking, okay, and that means that actually in this situation, when that happens, my response is likely to be this. And actually, from a professional point of view, because that's probably not helpful, actually. And I think it's just understanding some of this stuff could be very helpful for us. And we're doing a disservice sending trainers and behaviourists out in the world without this, because, my husband, he's a hospice nurse. He gets supervision. He gets clinical supervision, which is important, of course, every quarter, but he gets personal supervision every month. He says he could not do our job. Which I think is really quite humbling for us, because we would think, bloody hell, he's a hospice nurse. That must be quite tough, and it is. But so where is the pastoral care? We have to make sure that we are letting people know, if you're turning up to another living sentient being, both the dog and the human, we have to be better equipped to make sure that we can protect ourselves in the process. Being able to turn up to the emotional experience of another but not feeling responsible for it is a really important skill. And that involves personal boundaries, professional boundaries. It enables us we have to have confidence in why we're there. Otherwise, we're taking home other people's misery and crisis and pain. And it's not tenable.
Wow, wow, wow. That was so awesomely packed with so much info, knowledge, experiences. Um, I don't even have the words to thank you to just being here today. Can't find the words, I've just lost, because I sat here, and I'm sure Samantha feels the same, and I have taken in and have learned so much. I want to say thank you, Andrew, for accepting the invite to come along today, because this is an awesome podcast. Yeah. And a lot of it I can relate to. A lot of it was deep. I can relate to. Absolutely awesome. So I just want to say thank you, thank you, thank you. Yeah. And if anyone wants to get in touch with you because they want to tap into some of your services, how will they be able to do that?
The website is probably the best thing. I'm kind of changing it as I go, but dogcc.org, that has some information about a new service I'm launching very soon called Your Safe. It's there, but I just haven't made it public yet. But Your Safe Space, which is for animal care professionals, really to have a bit of help, in a one-to-one confidential way to find their own healthy professional presence. I've got what I call my 5 missions that I support colleagues to go through, because that's finding your story, because we all have a story, and quite often we dismiss that story. You and I have been around for long enough, Colin, to see professionals at one end and then see them now, and you think, that story you're telling now isn't that other story. I know, for example, that you're a crossover trainer, or I know this and that, and it's a shame that our own insecurities mean that we rewrite our stories. Well, guess what? There's enough people to rewrite our stories for us.
Yeah.
That unhelpful teacher at school, that parent, that whatever, So find your story, because a lot of the stuff people will often say, oh, do you know what? I understand that now. And despite that, I'm actually doing this job. But actually, often it's because of that. It's
Yes.
because you didn't feel you had a voice. It's because you felt left out. It's because you see the pain and suffering in others. And it's embracing that and recognizing that helps us to turn up to work in a compassionate way. But actually, that can also be the thing that nobbles us too. So we have to be aware of it so we can protect ourselves to do that. So find your story, find yourself, your true self underneath all those that noise from others who are telling you what you are and what you can be and what you shouldn't be. Find your purpose. Most people come into animal care because of a passion, but that is really fragile. The passion is going to likely to break. We need to find a purpose from that. Once we truly find our purpose, and that might seem pretty straightforward, but actually everybody I've supported through this is when we keep asking the question why, yeah, but why, but why? It's interesting to find out what that purpose is and where it's grounded. And that's our biggest shield, then, our purpose. The reason I keep doing what I do is, despite other people might say horrible things or do horrible things, I think, right, take a breath. This is my purpose. And am I true to my purpose? Am I working in that authentic way? Find your structure, big one. The amount of people I've worked with who just don't work with a healthy structure, which isn't just
Mhm.
about admin, but even just how you turn up, how you work, and all these kind of things. And then finally, find your presence. That's that healthy professional presence, that little bit of us that is us. It's not a made up bit of us. It's that little bit of us that we're happy to put forward and be vulnerable with. While the
Mhm.
rest of us is a work in progress. Oh my God, it totally is, right? If I came as my full Andy all the time, it would be a bit much, as my husband will tell you. But so we have to find that professional presence. So that's your safe space. That's on there. And obviously my dog center care channel. I've got my dog center care YouTube channel too. And I just want to say something quickly. Obviously, Samantha, we don't know each other that well yet.
No.
But Colin, we've known each other a while, and I thank you what you said at the start, but it goes both ways. Uh, I love how you work. I love how you educate. I find you a real inspiration in the community, and this is how it should be, right? We learn from each other, we grow with each other. There seems to be a little bit of a part of the community which is, I call it the golem effect, where people just want to claim stuff and create a little mountain for themselves and attract those who will just see things through their lens. I get it because that's often, again, a lot of things we talked about to find this, how they've found their safety. I think what you do to be truly open and encouraging of others, it's a beautiful thing. And I think we all need to be humble enough to just keep learning from each other and growing together, really. Nobody popped out the womb. You'd think they did, actually, the way they talk. Nobody pops out the womb thinking, oh, yeah, I know all this stuff, or I've created this model, I've created that. It's like, there's nothing new under the sun. The only thing that's unique and beautiful is our individual perception of it, our individual way of filtering it. But we all stand on each other's shoulders, really. I think this is an important thing. So I just wanted to thank you from my side.
Andrew, it's been absolutely awesome. Um, Once again, thank you for coming along. To everyone that's watching this, please hit the subscribe button. Please hit the like button so you don't miss anything, any content that we do put out. I'm going to say goodbye from myself, Colin Spence, and goodbye from Samantha, and a huge, massive goodbye from Andrew Hale. Bye for now.